The Dancing with Depression podcast is brought to you by CAS-CM, where CM stands for Content Matters, because content brings people together. Growing up, if I had a stomach ache, I took the pink stuff, and almost instantly, I felt better. If I got sunburnt, aloe vera, immediate relief. The flu, take some over-the-counter drugs, get some rest, and you'll feel better in a couple of days. As far as allergies, man, for me, Allegra D is the go-to. I stopped sneezing or getting that front of the head headache after about 10-15 minutes. You do have to go to the pharmacy and actually present your license. So naturally, when I was introduced to anxiety, depression, my first thought was, what can I take to get rid of this feeling? Because that's how everything else worked, right? And just to give you an idea of where my understanding came from, growing up in the 80s, I remember hearing about the war on drugs. I had no idea they were talking about crack cocaine. I thought they were talking about, like, NyQuil and Pepto-Bismol getting out of control. I know it sounds silly, but give me a break. I was like 8 years old. So yeah, my framework for all of this probably wasn't the most advanced. But when the medications I was prescribed didn't work the way I expected, I got frustrated. I became skeptical. I even started questioning the system. And looking back, I wasn't just frustrated. I was misinformed. Like a lot of people, I went looking for connection. I joined some social media groups, people from all over the world, all trying to help each other. And I want to be clear, these were good people, well-intentioned. But what I started to notice was a lot of advice being shared from people who may not have been qualified to give it. And at the same time, there were people in those groups who didn't have access, like insurance, money, other resources. So those conversations became their only option. And that's where things can get complicated. Because yeah, support matters, but support without the right guidance can sometimes create more confusion than clarity. So today, I want to better understand not just medication, but how this whole process actually works. From someone who does this every day, I'm joined by Dr. Ankur Saraiya, a psychiatrist who takes a more comprehensive approach to mental health, looking beyond just medication to include lifestyle, behavior, and overall well-being. My goal for this conversation is simple: create clarity, reduce confusion, and help all of us better understand what actually is going on. But before we get into all of that, I'd love for listeners to get to know you a little bit better. So, Dr. Saraiya, welcome to the Dancing with Depression podcast.
Thanks so much. Looking forward to the conversation.
As am I. So before we get started, just a little bit of a background. Can you share kind of what got you into this field in the first place?
Sure. So I was in the subset of people who went to medical school, not very, very sure of what I wanted to go into. I was very curious about a variety of different specialties. But at the end of the day, what drew me to psychiatry was just, I like hearing people's stories, rather than sort of boiling patients down to a body part or to a condition. I like the big picture. I like putting people's struggles kind of in the context of their lives. And that's what psychiatry really does. That's how we approach treatment. So that's how I got into the field. So I was, you kind of narrow your path as you go and you spend more of your clinical time sort of in the areas that you think you're interested in. I just kind of narrowed. And then when it came time to pick a training program, I just chose psychiatry and very happy with my choice.
Awesome. Do you think that there was a specific moment or experience that kind of made you focus on the mental health side of treatment or you kind of mentioned like medical and kind of going down that path? Was there anything that stood out that kind of was the aha moment?
I think it's related to a few. So I think my first. I don't know if it was my very first exposure, but what I remember was my experiences during my pediatrics rotations and a couple of patients. And the thing about the psychiatric patients that sort of stuck with me is that with the physical conditions, I mean, I was very interested, very engaged kind of when I was at work. But then when I was sort of on my downtime, I kind of was, doing other things and spending my time doing, the things one does kind of on your free time. But with the psychiatric cases, I found myself not able to forget about them and kind of just thinking about my patients, during my off time and curious about how they were doing and how they were responding to the various treatments and everything else. And so the fact that it sort of stayed with me all the time was really kind of, spoke to me and told me something about like, this is what I'm meant to be doing.
Absolutely. Which totally makes sense when you take a look at kind of where your focus is. When I use the term like comprehensive approach to treatment, can you elaborate a little bit more what that looks like from your side of the desk?
Yeah, I think it really just boils down to diet, sleep, exercise, and relationships. And I kind of spoke earlier about like putting things in the context. And I think when we're specifically thinking about health and how to kind of right the ship, it can't just be about symptoms and medications and prescriptions. Like you have to put it in the context of all these other day-to-day habits that have a complete impact on people's well-being. So, and I really am always thinking in that full context. And I think that it's not to say that other practitioners aren't doing that at all, but I tend to exhaustively look at that and kind of always fit things into, sort of those 5 things. So the medications along with diet, sleep, exercise, and relationships.
That's pretty in line. I personally changed a couple of words for my help personally. I use, instead of diet, I say nutrition. Again, this is for me because when I say diet, it's like an automatic, oh God, I think of all the things I can't eat and what I like. And then for exercise, I've morphed into movement because for me at the time, the thought of exercise was when I was in my 20s and I was having a hard time just getting out of bed. So Bobby would say things like, just move, get some, sunlight and so on. So if I refer to it, I'm in line with diet exercise. It's just kind of the terminology I use.
Yeah, I use those terms as kind of like a kind of broad kind of guideline, but
Mhm.
definitely you sort of amend each one again, sort of to a patient specific situation and context. So absolutely, if somebody is at the point where they're just having trouble getting out of bed, for that situation, I am not drilling them and saying, you got to get to the gym 5 times a week. Like you definitely adjust it. And I think movement is an excellent way to kind of make it seem more accessible. Like just see if you can just get your body moving. And I think that's powerful. I think that's actually very important. It's not a cop out. It's not a shorthand to eventually get to what's helpful. I think the movement if that context is very helpful, but absolutely. And then to your point, diet, again, like I think that's where you get into the jargony thing. Like I think for a doctor,
Mhm.
we think of diet and it doesn't, for me, diet triggers, I think what we're talking about, which is all the inputs that we
Yes.
put into our bodies. But I
100%.
totally understand that from the, kind of out in the world, the diet has sort of certain connotations that are definitely can be negative. So I think we're on the same page, and that's why this kind of conversation I think is important, that it helps clarify these differences. Because if I'm with a patient and I throw out the word diet, if I'm not paying attention to sort of my patient's reaction, I can miss out on the fact that I've sort of off-put them a little bit when I'm just like, hey, we just need to think about what's going in.
Yep. 100% spot on. Yeah. And so it also, again, ties to, things that may work for me that might not work for everybody, but that is kind of one of the things that is something that has been helpful for me. And so when we look at it from those perspectives, right, what I had mentioned earlier was, I was kind of used to this idea of I felt something, I took something, I felt better, right? With regards to like a Pepto-Bismol for an upset stomach or so on.
Yeah.
So when you look at mental health, anxiety, depression, and a couple of other things, why don't we respond the same way as those other medications that I'm used to?
Okay, so I guess I have to remember that we're specifically talking about, I guess we're talking about depression.
Yeah, I mean,
Yeah,
I
so
use that one specifically, sure.
yeah, so I'll just mention sort of generally that it is important to make that distinction in understanding what we're trying to target, because there are certain conditions in mental health where, depending on the medication, you can get more of that immediate response. But the why question as to why it can take certain treatments longer to work, we don't really fully understand. But we just know that it's definitely the case. Like, there are certain treatments that use a certain mechanism where the response is absolutely on the order of weeks to months rather than minutes to hours.
Gotcha.
And again, we don't know exactly why we have not been able to find treatments that have a faster response rate, but I emphasize it so much because when you're going through it, it's absolutely understandable that it's difficult to kind of have the patience to wait and to really even believe, because it just doesn't make intuitive sense. Like, I'm putting this thing in my body every day. I've given it days, a couple of weeks, and nothing. And, the doctor tells me that it's doing something, but I don't really feel, hopefully you don't feel like that. That's what I tell my patients, is that the first month is about side effects. So we're hoping you feel nothing in the first month, because it's really just about tolerating the medication. And that's really towards the end of the second month that we're looking for response.
Perfect.
But we don't know why.
And that is kind of in line with what I was going to ask, is for someone that is not as familiar with how it should work, or does work, or whatever, is there a realistic expectation when they're starting the process as to what things to look for, what things to kind of seek out, as far as, does it make sense? Is it working? Is it not working? Like, what am I looking for?
Okay. I don't think this is the primary thing you're getting at with this question, but I'm going to use this as an opportunity to make my plug.
Okay.
Which is, I think that because this question is not easy to answer, if you have the opportunity to get your treatment from a psychiatrist, you should. I think that people, for a lot of reasons, sometimes it's access. Sometimes they can't get in to see a psychiatrist, and that's unfortunately part of the system. And if you can't get in to see a psychiatrist, absolutely work with your primary care doctor or whoever can, prescribe and help you manage the medication. But the reason that I say, if you do have the opportunity to see a psychiatrist, to take advantage of that, is because we are better positioned to kind of manage these kinds of questions through the beginning of the process, because it can be so hard to wait and to know, kind of what to do and what to look for. These follow-up appointments kind of in the early part of the process, even though it can take 8 to 10 weeks for the medications to kick in, I do my monthly, or even like I'll do my first follow up anywhere from 2 to 4 weeks, because that first follow up to kind of educate the patient about these things and to kind of almost be a little bit of a cheerleader and to be like, kind of like, we need just to reassure them and explain, like, truly, you just have to, I mean, you have to take the medication for it to work.
Mhm.
But it can get tedious to take something that doesn't seem like it's doing anything and take it every day. And, you've taken the entire first month, nothing. And then I'm asking you to go get a refill and pick up a refill and keep doing it because of my claim that it's going to kick in. But absolutely, like, it does. And I've had many, many experiences where, we're at week 6, 7, 8, patients kind of like nothing. And then week 9 and 10 roll around and they start to notice some movement. So in terms of what to look for, like, it's really just, you got to take that leap of faith, like truly, truly get that full trial of 10 to 12 weeks before you sort of, kind of make an ultimate conclusion on that trial of that medication.
Yeah. And I'll certainly put a stamp of approval on what you were mentioning, which is if you have the resources to work with a psychiatrist, because as you alluded to, I had my primary doctor. He did a fantastic job. He was wonderful. But at the same time, he's analyzing and reviewing and looking at so many different things. It's something that needs to be pinpointed. And we've even had an episode where we talk about the importance of, the evaluations and really understanding what is going on. Because from the way it was described to me, there can be things that look like something, but they're not the root cause. And you could be treating that, but that might not be the solution. So I think that combination and going to the trained professional that can hone in and stay the course a little bit. It's a little bit longer than maybe what you're used to, but like you said, it has to get into your system. Everybody's bodies are different. And so we want to make sure that we give it the time that it needs, and you're there to watch over that process, right? You're not going
Yes.
to, it's going to work. It's going to work. No, we have signs, we have ideas of what's going on. And those are the things that we'll monitor because, I'll be honest, like at one point I was like, is this just the way the system works? Right. That's kind of what I felt was and again, not to get into like this deep conspiracy theory, because that's not what it is, but I was just like, why is this working for somebody else but not for me? And so, when you look at it, medications react and act differently. And so with that being said, you said that there's a certain time frame that you're kind of monitoring, right? Is there a significant difference when you're looking at factors like what mental health you're treating, what they're doing outside of the medication? I kind of want to talk a little bit more about that when we go back to the diet, exercise, sleep, and so on. How does that play a part in your process overall?
So, yes, the other inputs do have a factor, and that's why we're interested in them. So what I mean by that is, along with, so first you do the evaluation, you diagnose that this is the condition that we think, is explaining a patient's symptom, and we start the medication trial. The other things I'll be looking at is the things we talked about: diet, sleep, exercise, and relationships. So, is the individual executing on those things? Are they getting some movement? Are they getting good sleep? Are they avoiding, early on, like with diet, like, broadly speaking, yes, we all know we want a healthy diet, but acutely when you're treating a depressive episode, one of the things I'm significantly looking at is alcohol intake, or in some cases, marijuana. Like, these other factors can have an influence on symptoms and response to medication. So you're definitely going to have different expectations from the patient, where they're still struggling with their alcohol use and they're kind of still pretty isolated, not really eating great. And you'll have different expectations for the patient who is super, has bought into the program and is kind of firing on all cylinders. They're making sure they're in bed at the same time every night. They're, absolutely, leading a clean diet. They are actually getting themselves to get some workouts in every week. And so you have different expectations, and those are obviously the two extremes, but there's an influence of kind of when you take all of those factors into account, it helps me kind of reset expectations and the timetable based on how well a patient is doing at all the other things that we can use to help treat a depression.
Absolutely.
So, and you help evaluate those things, and you help try to, assist the patient. So, in particular with sleep, people are aware, like you can try various sleep aids to try to help somebody get better sleep, and that can sort of facilitate recovery from a depressive episode.
Awesome.
And we often use, multiple medications kind of early on with the idea that, once we get past that kind of first 2-month period, we'll be able to peel some of those medications off.
Gotcha. Okay. So they're there to kind of aid the process to move it forward, but then you're able to get those to the side and establish a little bit more foundation-wise, I guess is the best way to put it.
I mean, the sleep disturbance is a common component of a depressive episode. And I think, in particular for an individual going through a depression, if we can get them to the point where they're getting good restorative sleep every night, like at the very least, that serves as kind of a break for individuals who are, they're not sleeping that well. Then it's just an endless cycle of like, they wake up to sort of a full kind of experience of depression with no sense of like when they might get a break from that. But if you get them on a pattern where you find an effective sleep aid, no matter how bad it is during the day, at least they're like, well, I can look forward to taking my sleep aid and having a good night's sleep and at least having a break that I can rely on. And that sort of goes a long way to sort of getting through the waiting period until the medications kick in, the antidepressants kick in.
Makes sense. So in your experience with the folks that you meet and treat, I'm curious how many people are aware how effective sleep is for them. Meaning, do they realize that, oh, maybe I'm experiencing more frequent depressive states because I'm not sleeping? Or are they aware of that type of thing? Or is that something that when you're sharing with them is kind of like a aha moment? They start to peel back the onion and see, oh, you know what? Yeah, I went through something that was traumatic, but I also started eating a different way. I stopped, being active, and I wasn't getting good sleep. Do they see that? Do they know that? Or is that something that is kind of heard for the first time?
So I think this is one of those areas where people generally have an intellectual awareness that things like sleep and diet and exercise are important. Like these are things that are important. Like we should be doing certain things with our diets and with our exercise and with sleep, but they don't like really get how impactful they can be in both directions. Like they don't realize that by neglecting these things, I'm not putting blame here, but that there's a connection. Like the neglect of these good habits is directly contributing to the frequency intensity of their depression. And the flip side, they don't realize that if they're able to improve those habits, that will have a palpable impact on their improvement. Like it'll accelerate their response to medications and just, make a difference that they can experience. And again, like there's like you start talking about these things and people like they almost glaze over a little bit. Like they they're like kind of like nodding, and they're like, yeah, I get it. Yeah, of course. I know. You're supposed to get 8 hours. Sure. I know I shouldn't be eating so much junk food. And they kind of yes it, like they kind of know it, but they don't really get like, no, like this is going to make a difference. It's important to make this decision. And each of those little kind of binary decisions add up to, depending which decision you make, they can add up to benefit or they can add up to depression.
Yeah. I know people can't see me, but I'm shaking my head like a bobblehead because I'm right in that space right now where, I talk a lot about, we have access to so much information. We know what to do, right? The question is, why are we not moving forward with it? And do we understand the real value behind it? What I've been working on is not to overwhelm myself because there's probably a list of 25 things I could do differently. And it's about creating that habit and doing something different for, I think they say 21 days to change a habit or create a habit. And that plays a significant part because I do believe that, I'll speak for myself, I won't speak for everyone, but we tend to beat ourselves up on things. And
Yeah.
we have to realize that learning something new and the value is different today than it was maybe in the past. I joke about this. When I worked out in my 20s, I was trying to create little muscles that I could see in the mirror when I walked by, right? But I didn't realize the intrinsic value related directly to my mental health as far as what it was doing beneficial wise, right? Because it wasn't my focus. And so now I'm able to say, I'm going to move, I'm going to work out. I don't care about the muscles. I care about smiling, getting out of bed and being able to live my life. And there's a lot of value in that. But to your point, we have to get past the I know what to do and so on and actually do it. And I think that's where your professional help comes in because it's not only recognizing it, but it's also factoring in other aspects that will contribute to that, right? So we know it. Now we're implementing it. We've got somebody to guide us along the way because maybe you thought it was going to change in 3 weeks, but you needed 6 weeks instead, right?
Yeah.
So all of those start to play a part.
I was just going to say just an anecdote. Like for some reason, this reminds me of an experience that I had sort of providing treatment during COVID. So I had patients that I'd been working with for many, many years, and I would kind of hammer these, in particular, the example that comes to mind is exercise. Like I would be hammering my patients every appointment. Like you've got to get into a workout. You got to trust me. Like you're going to start, it's going to make a difference. Like, we're having these little breakthrough symptoms. Exercise is the thing that's going to put you across the finish line. And one sort of interesting thing about COVID is that because it completely changed people's schedules, I had a subset of patients where they finally had time to exercise.
Yeah.
And so during COVID, they actually started to exercise because they needed to fill their time. They needed something to do. And they've known all along that exercise is something that they should be doing. And they started doing it. And one of the interesting things sort of during follow-up appointments during that time is patients would sort of sheepishly admit to me, they're like, Dr. Saraiya, I've noticed that like since I've started exercising, I don't have to take my as needed anxiety medications like almost at all. Or other patients are like, since I've started exercising, I have no more sleepless nights. Like I sleep well now all the time since I started exercising. And I was kind of like, see, that's what I was talking. But again, like we don't have that magic wand to give people that awareness. Like they hear it, but they somehow almost instantly dismiss it as like, I wouldn't argue that it's not true. I don't really believe it. And then during COVID, I had like a few dozen examples in my patients where they finally were able to implement it. And it was like very deja vu kind of experience for me. They would come in, and when they would say, they would kind of sheepishly, you know what, Dr. Saraiya, I've been exercising, and lo and behold, I'm across the finish line.
That's awesome.
And so it truly makes a difference that they can feel. And that's the message I try to get across to people.
That's a great example. I think with all that happened for COVID, obviously there were a lot of pivots and changes, and a lot of people will say that, there's pluses and minuses.
Mm-hmm.
And I think time is one that people were able to get back and do some things that they weren't able to do in the past. It does really remind me of even younger, the working out, and how everybody used to talk about 80% diet, 20%, exercise was how you formed your body and the muscles and so on. And I didn't at the time really comprehend, because I ate what I wanted. I had, my metabolism was like, don't worry, dude, I got this, right? And then I hit like my early 30s, and it was as if my metabolism had retired without telling me. And things just didn't happen the way they used to. And I really started to understand nutrition side of it. So that's an awesome example of being able to implement and seeing the results, and that now there's no denial, right? They know it, they got it, they understand it. And now the conversations may have to shift a little bit to, hey, you got to make the time, right?
Yep.
You got to make the time, because and
that's where we are now. Now that we're sort of in the post-COVID world, some of these individuals, despite having the experience, they're starting to succumb to the demands of their, post-COVID schedule, and impinging their ability to work out as, consistently. And they're starting to get a little slippage. And I'm in their ear sort of reminding them, like, look, it's not optional. You have to make the time. Otherwise, you're going to feel the ill effects of not taking care of yourself in this particular way.
Yep.
And it's just, we need it. We need to be moving.
Absolutely.
We were designed to be moving, and just the modern world is not promote that for everybody. So we got to do something about that.
Absolutely. We'll start here. So the other thing I want to kind of get your perspective on, and I've shared this candidly, this is not something that I would put at the top of my list of, great job, Adam, but it was real and it happened. And that was, I had stopped taking my anxiety and depression medication. And I made that decision on my own. I purposely didn't tell anybody, especially my wife, because I didn't know that she would say no. I was just pretty sure it wasn't something I wanted to be told I couldn't do, right? So my question is more so from your perspective, someone that is considering coming off of medication for whatever reason, what would be something that you want them to understand first before they make that decision?
A few different comments here. So number one, sort of, I think, potentially contrary to listeners' expectations, I do take my patients off their medications, sort of with some regularity.
Okay.
This is the rule of thumb that I go by. It is based on something, but I want people to not hold me to this just because I don't have the references off the top of my head. But the rule of thumb that I go by is that if somebody has an initial depressive episode, it's reasonable to consider a trial off of medications. Even with a second episode, in certain situations, you can consider coming off of medications. But once I have a patient hit a third episode that we treat, at that point, I think it's advisable to make sure that you stay on your medications. So that's sort of a broad, hard and fast. Now, I say that doesn't mean I take all of my first time and second time patients off of medication, because you have to put it in each individual's context. What do I mean by that? One is side effects. There are some fortunate individuals who have no side effects. They truly have no side effects from their antidepressant medications. No sleep disturbance, no weight gain, no sexual side effects. nothing. They tolerate them like a multivitamin. For those individuals, it's a different calculus than for the individuals where they definitely worked, they definitely got them out of a depressive episode, but they have, let's say for a common example is they have sexual side effects. They have, the medications are killing their libido. Those are different scenarios with different kind of, a different approach potentially. And so that's one thing you have to take into account is like, what are the pros and cons of staying on the medication versus not staying on medication? The other thing that I would point out to people is that life happens. And sometimes what happens is I'll have a patient who's kind of sort of wondering about whether they want to maybe stop their medications. And then they'll run out of their medication and kind of can't get to the pharmacy. And they don't take them for like a week. And then they decide, maybe I'll just stay off of it now because I've been off of it for a week anyway. And so I would say two things to that specific scenario. First of all, that is not the way that I would decide when and how to do a trial of the medications. You want to consider like what's going on in your life. And the other thing that people don't realize is that the wearing off of the effects of medications is somewhat symmetrical to the onset. What I mean by that is if I have a patient who's on medication and they've been off for a week and they're like, I didn't feel much difference, that doesn't mean very much to me because the antidepressant effects are not going to be lost. Like I said, is similar-ish timetable. Like I'm going to be most interested in how they feel a couple of months after they've been off their medication, not right when they stop their medication. And some patients really forget that and they interpret not feeling that different, missing their medication for a week, as proof that they might not need their medication anymore. And I think that's a bad source of information for that specific question.
Absolutely. Yeah. Like I said, it wasn't my proudest decision. I learned the hard way. And, I definitely felt the effects after about a month and for about 3 or 4 days. I don't know how to describe how I felt, but it wasn't good. I just felt terrible, didn't have much movement by any stretch. And, I thought it was finally the COVID hitting type of deal because I couldn't explain it any other way. And tested and tested several times. And then I spilled the beans and you haven't met my wife, but she's a 4 foot nothing, but knows her stuff. And she just shot me a look. And I was like, oh, I screwed up bad on this one.
If I heard everything correctly, all the details, it brought up another sort of thing that I wanted to mention, which is the idea of like your response in that first week not really being very relevant. It cuts both ways. What I mean by that is, I think what you're describing is a bit of withdrawal from medications, which is when you suddenly stop your medications, you can have an immediate physical negative withdrawal experience. That does not necessarily mean that you can't come off or it's not a good time to come off your medications. Like the withdrawal that you experience in the first days to weeks stopping medication is almost completely separate from the question of whether you need to continue taking your medications. So they're kind of separate questions. So there's a if you go off gradually, you can usually alleviate the vast majority of those withdrawal experiences. And the other thing that I want to emphasize is that, first of all, I want to say that most psychiatrists, I believe, would be receptive to a conversation about stopping the medications. Even if the psychiatrist ultimately disagrees with the decision to try coming off the medication, they will still be in a position to help you come off the medication in the most comfortable way. Like they're not going to, like ethically, just because you kind of decide not to follow their recommendation, they're not going to abandon you and leave you to your own devices. Mm-hmm. So you go in and have a kind of collaborative discussion. And if they say, I really strongly recommend that you stay on the medication, and you say, well, I hear you, doctor, but for my own reasons, I really think I'm ready to come off the medication, they will probably continue to try to convince you. But ultimately, if you stand your ground, they will advise you on the best way to come off your medication. So I just say that because you said you did it sort of in secret. And I think one of the reasons to not do it in secret is because you want that advice on how to do it the most advisable way.
Yes.
And even if your doctor doesn't agree with your decision, they will still advise you on how to do it the most advisable way.
Yeah. And when I made that decision, great to add that context, I was not working with a therapist or a psychiatrist at the time.
Okay.
So it was, to your point, absolutely a conversation I would have had. But yeah, I had been on the same medication for about 10 years, and I was noticing other things where I just kind of felt numb. And so that was something I wanted to change. So, couple of things before we part, but one of the things that I talked about was kind of like the misunderstanding in as far as expectations that medication was to fix something when maybe it's more about managing it, right? So, if you're looking at it from that perspective, would you say it's fair to think of medication more as a tool rather than a solution?
You took the specific word that I would use right out of my mouth. That's absolutely the word that I use to describe medication. They're absolutely a tool. They're not necessarily a cure. They're just a tool to help facilitate recovery from an episode and to prevent relapse. And so, yeah, that's absolutely how I would describe them. And it kind of goes with my approach of sort of including the other diet, sleep, exercise, or relationship. So,
Sure.
That way we can kind of utilize everything together, and people don't have they don't have an idea that it's either or. I can either take medication, or if I just, fix my sleep and start working out, can I approach it that way?
Mm-hmm.
I mean, you could, but the best thing is to avail yourself of all the resources and do it, as fast as possible and as efficiently as possible.
And I think that that's something that we can look at elaborating on with some additional insight, because I do think that all of these together are helpful to have a better understanding. I guess to kind of wrap up, my final question to you would be, what's one thing you wish more people understood before they start medication for something like anxiety or depression?
I mean, this is another thing that may not be a direct answer to this specific question, but another thing I wanted to kind of throw out there is that having a consultation with a psychiatrist or really any doctor is not equivalent to the decision to start taking medications or starting a specific therapy. So one message I would give people is that you can treat a first meeting with a psychiatrist as an information session. There is nothing that says that you must make a decision and start whatever potential treatment is offered right at that first appointment. I mean, pragmatically speaking, that's often what happens. People come in usually expecting that they're going to be offered medication and they're ready to kind of default start that. But you don't have to get to that point. And actually, I would say it's probably useful to get your questions answered sort of as you're in the process of trying to figure out whether or not medication makes sense. Get the information and get your questions answered before you make that decision or have to make that decision. So that's one message I would say, is that first evaluation meeting does not obligate you to then start medication. And I have patients who, for a variety of reasons, are a little bit on the fence about whether or not they want to start medication. And I will tell them, I'm like, you don't decide right now. You can, we've had the information. You can think it over, do a little bit of research, talk it over with your family. And then let me know. And if you decide that you would like to start, I can send a prescription in. If you decide you have more questions, and we can set up another appointment and we can talk further about it. Like either way, like I have it sometimes. I mean, most often the former, most often people will think it over and then send me an email saying, I think I decided I did want to start the medication. And depending how in depth our conversation was, sometimes I'll just send it in and say, great, let me know how, we'll make an appointment. Or sometimes I'll pick up the phone and say, okay, I want to make sure that, we're on the same page and you understand, X, Y, and Z. But yeah, so that's what I would say, is that you're not obligating yourself to anything just by meeting with a psychiatrist.
Gotcha. And I'm going to input this kind of alert. I'm going to ask a question because I'm really curious. I have no idea if it's going to align, and sometimes the way I ask it, if it's not prepared, comes out a little weird, but that's just the way I am in my personality. It's kind of like a joking but serious question in the sense of, do you recommend or have a position on someone who, assuming they can meet with multiple psychiatrists or whatever, see if I don't want to say if their philosophies are different, because I feel like they're, aligned with, what that person's going through, but I don't want to treat it like, you're getting a roof done and you go get 3 quotes type of deal. But what are your thoughts related to that kind of process when it comes to working with a psychiatrist?
I would say, in an ideal world, I think it would be great if you could treat it like getting your roof done and get 3 different options and be able to compare the 3 options.
There's a lot
not just on cost, but also on just match, because treatment match between provider and patient is actually a pretty significant factor in how successful the treatment is, which, makes sense, makes intuitive sense. But it really, like, this has been studied and corroborated that, having a good match actually facilitates. It's not an absolute necessity, but it does help a great deal.
Mm-hmm.
So yes, in an ideal world, if you could, but I think pragmatically speaking, the way that I think would work out is that what I would say to people is that it's important to keep in mind that one particular psychiatrist is not representative of all psychiatrists. So pragmatically speaking, if you go in and you meet with somebody and it's just doesn't, like, you just don't have like a rapport at all, and again, it's a big ask, but you have the resources to make a change, I would say it is worth it, and it could make a huge difference. You're not going to get just necessarily a repeat of the first person. Like, we are different individuals with different approaches and personalities, and I will say, like, I mean, there's definitely patients where I feel like I'm not the best match for them, and I will do my best for any patient who sees me, but I'm well aware that certain individuals they do better with a slightly different style or a slightly different approach. And, I tend to be more collaborative in my approach. I kind of take, like, me and my patient are kind of like, partners. There are some people, for a variety of reasons, in particular, I think of psychiatric patients, where they just need somebody who's going to tell them what to do. Like, they don't want to, like, participate in the decision process. They're like, doctor, I came to you for your expertise. Don't ask me what I think I should do. You just tell me, do this, and I'm going to try to do that. And that's how I want to do it. There's nothing wrong with that.
No.
Like, I think that that's fine. It's just not my primary way of function.
I'm laughing because you literally just described my wife as one and me as the other. She's going to be like at the drawing board with you, and you guys are going to collaborate back and forth. And I'm the person that's going to be like, just tell me what to do. So thank you for that. That definitely hits home for sure. And I experienced that when I was looking for, a therapist. I had great experiences, but I did come across one that she was fantastic. She'd done it for a long time. It's just her style was a little different.
Yeah, I want to be clear. So I was talking about specifically like a prescribing psychiatrist when I
Yes.
gave my initial answer.
Yeah.
But to your question about like, if the question was shifted to what's the approach on finding a therapist, then there's definitely more of an emphasis on trying to meet with multiple people.
Yes.
Like, I would say that, I mean, it's still like presupposes certain resources and access and having people available. Like sometimes you just don't have the luxury of having, getting 3 appointments like within a few weeks of each other. But if you can, like you should make an effort. And I would say 3 is the number I would say. Like if somebody asked me like, what should I do in terms of finding a therapist, I would say, see if you can meet with at least 3 different, three and exactly 3 people. Cause I think you're likely to get a good sampling of kind of the different options that are available, and then trust your sort of general gut feeling about kind of who you seem to mesh with.
Absolutely. Absolutely. So I, again, have had a chance to ask you a ton of questions. I like to end with an opportunity. If you have a question for me, it can be related to anything except me giving you the winning Powerball numbers because I don't know them. But is there anything that you have that you'd like to ask me?
Yeah, not off the top of my head. I mean, I think I got all my kind of like the things that I wanted to sort of emphasize. I think I was able to sort of get them in there, and yeah, nothing comes to mind. I think it was a good back and forth, and I think we kind of covered everything in the natural flow.
Awesome. I agree. I think it went really well and very, very happy with this opportunity. And I also think that there is some potential future opportunity. So we can
Great.
explore that and dive in a little deeper. But thank you so much, Dr. Saraiya. I appreciate the time, the expertise. And with that being said, you are now officially a part of the Dancing with Depression podcast family. So
Wonderful.
And so I'll wrap here, but again, thank you and look forward to reconnecting soon.
Okay, thanks so much. I had fun.
Dr. Saraiya shared a lot of great insight and information. There's one thing that stood out to me. It's that the things we overlook are oftentimes the things that matter most. Not in theory, in practice. It's a pattern we've seen across conversations, whether it was Allison or Katie. In different ways, the signals were there before they were fully acknowledged. Their bodies were talking to them. It also reminds me of a bit from a comedian, Bill Engvall. He had this routine where people would ask the most obvious questions, like, when he's loading up a moving truck and someone says, "Hey, you moving?" And his response was, "Nope, we just pack everything up once a week to see how many boxes it takes. Here's your sign." Now, I'm not suggesting that when it comes to our mental health, the signs are always that obvious. But the reality is, there are signs. Because the body shows stress before the mind fully processes it. Low energy, brain fog, running on empty, that's a signal. Feeling anxious, overwhelmed, or short-tempered, that's a signal. Feeling disconnected from others or even yourself, that's a signal. It's how you fuel your body. It's the rest you give yourself. It's the relationships you keep and the one you have with yourself. These aren't small things. They're inputs shaping everything. So, wherever you are right now, start there. Pay attention because your body might already be telling you exactly what you need. Remember, when it comes to taking care of yourself, take the lead. Ever heard the saying, "It takes a village to raise a child"? Well, same applies here. It takes an awesome audience like you to help get this message in front of someone who needs to hear they're not alone. That's why I ask for your continued support. Whether you like, share, follow, or leave a review, and if so inclined, can donate, it all helps more than you know. If something resonated, pass it along. You never know who needs it. Want to connect? Email me anytime. dancingwithdepression@yahoo.com. And remember, when it comes to depression, take the lead. Content and safety notice. Dancing with Depression may include discussions of suicide, self-harm, trauma, and emotional distress. Listeners' discretion advised. This podcast shares personal experiences and is not a substitute for professional mental health care. If you need immediate support, call or text 988, the Suicide and Crisis Lifeline. For non-crisis help and resources, contact NAMI at 1-800-950-6264.